Good morning. This session today is about soft skills in healthcare, more so in surgery, because the examples that I take, I'll be talking about the operative theatre environment. Now, soft skills are important and they are non-technical skills, like you know how to do surgery, but then that is a technical skill. You know how to do a herniatomy, again, that is a technical skill. But how exactly you talk to your colleagues regarding the day-to-day activities, how you talk to the anesthetist, how you communicate with your patients, how you communicate with the relatives, all these form the, or with the support staff, all of them are known as soft skills. They are important for every industry, more so when the industry has an interface with other human beings, like your airlines, banking, and your healthcare also. So they are also known as non-technical skills, essential skills, or real life skills. There are many names. In fact, it's called the fourth industrial revolution. Now, people realize that it's not only technology that is going to be of very good benefit, but also a set of soft skills to go along with the technology to make life comfortable for everybody around. So, what is the importance of soft skills in surgical practice? This is for medicine itself, but I purposely put surgical practice. What is the main aim? It is to enhance patient outcomes and team performance. The moment you enhance team performance, automatically you will be able to get better patient outcomes. It's very simple. So what is the introduction to soft skills? Definition. Soft skills are personal attributes that enable effective interaction and communication. Now, your 75% of long-term career success is attributed to soft skills and only 25% to technical skills. So this is a comprehensive review of the importance of soft skills, the definitions, and the how we can assess them, how we can teach them, how it can be assessed, and how they help in better patient outcomes. So whenever there is a bad outcome, it may be because of the disease process or it can be because of frank negligence. There are two people affected. One, it could be the patient who's undergone the bad outcome, or it is the physician who is sued for negligence. So the same sad person can be either a patient or even a physician. So don't always think it is the patient who bears the brunt. The physician equally bears the brunt. One, there can be litigation. Number two, there can be shame and blame. And number three, the physician himself may be feeling guilty. So what are soft skills for surgeons? One is communication, teamwork, decision making, and leadership. So look at the communication. This is communication for healthcare. I purposely put two staff handing over because the communication part is excellent between the nursing staff. They hand over everything very clearly regarding the patient. Time and again, we have found out that communication between two nursing staff is always the best in any given unit. Then teamwork. If you're going to go in different directions, obviously your team is not going to have the best outcome, which is obviously translated as bad patient outcomes. And decision making. Of course, your decision making cannot come overnight. You need some fair amount of technical skill for you to also be adept at decision making. And then leadership qualities. Leadership qualities are a personal attribute. Number two, some are born leaders, some can be made leaders. So there are various methods by which this leadership quality can be built up. As you go up the hierarchy in your healthcare, you might be having more of leadership roles than your technical roles. Your technical roles will be taken over by your junior staff. So coming to communication, see, All these are root causes of sentinel events. That means near misses, amputation of wrong parts, wrong surgery, wrong patient, or even death due to negligence. The main problem is communication. Now, this communication can be verbal, it can be electronic, or it can be plain written communication also. So that is very important. So the most important will be breakdown in communication. So what is the NOTSS framework? It is non-technical skills for surgeons. There is a framework here. And don't go into the example, I'll come down to it. What is it? Components is situational awareness, decision making, communication and teamwork, and leadership. Now, this is just an example. A complex surgical operation is going on. A surgeon notices that one of the surgical instruments is not where it should be, or it is missing. This observation prompts the surgeon to quickly assess not only the immediate situation, but also the potential implications for patient safety. Missing instrument. Number one, he needs the instrument to do the surgery. Number two, where is it missing? So if you keep these things in mind, you can also anticipate that there are going to be problems further ahead. So what is the key element in this scenario? Monitoring the equipment. That is a situational awareness. Number two, recognizing changes. Upon noticing, he decides he is going to look further. He is going to question further. And anticipating needs. He needs to communicate with the team. He needs the support staff also to help him out to find out exactly where is the instrument. This is just an example. It may appear very fairy tale, but this is what happens in the healthcare. More so in high intensive zones like your accident and emergency, ICU, in your operation theatre. These situations will be happening probably every 3 minutes. Now, is there an impact on patient safety? Yes, up to 40%, as I told you, sentinel events are because of bad communication. Now, once you try to effectively increase the non-technical skills, of course, technical skills are equally important, but if you effectively increase non-technical skills, they will definitely bring a lot of benefit to patient safety and reduce errors. So out of the non-technical skills, one very important thing is most important is your emotional intelligence. The moment you have emotional intelligence, automatically situational awareness, teamwork, communication, and also leadership qualities will be better. So the core skill is your emotional intelligence. It involves understanding and managing one's emotions and recognizing others' emotions. Now, what am I? Why I am stressed out? If you understand, there is a sister at this end of your surgery. She says the Gauss count one is less. Immediately your heart rate, BP, everything will go up. No problem. You recognize you are under stress. The situation itself is under stress. Once you recognize that you're under stress, obviously you will bring in your emotional intelligence to handle that situation in a very easy to handle way. Number one. So when you have emotional intelligence, you will have better intraoperative decision making, and naturally your teamwork and collaboration will go up. So during surgery, and surgeon expects he gets an unexpected complication. Let's have a look. During a GJ, when the retraction is being done, there is a laceration on the spleen. Now I'm telling you a situation that has happened to us. It is not a theoretical situation. And now patient has lost enough blood and he is critical. The atmosphere in the operating room becomes tense. Naturally, anesthetist will be tense. Everybody is tense. The surgical team is tense. Patient's BP is going down. How emotional intelligence will play a crucial role. Self-awareness. Yes, there is a problem here. Number one, that is most important. Empathy. In the middle, don't lose your calm. The most flustered person in the theater that time will be the anesthetist, because it will become death on the table. You see their problems for a problem which the surgeon has unknowingly created. During retraction, the spleen ruptured. So he needs to reassure the anesthetist, give him time for resuscitation. Number two, effective communication. The way he communicates with the anesthetist, with his juniors, with his staff nurses to get things ready. Of course, collaboration also. Conflict, any disagreements. For example, somebody might tell, no, this spleen doesn't need a splenectomy. This laceration can be done with a splenography. Of course, your conflict resolution will depend on the experience that you have as a lead surgeon. And you will make your decisions with the best interest of the patient. And you will be firm, but at the same time, you will be polite in sticking to your decision. So this conflict resolution is equally important. Now, let me tell you something. There will be enough people around, especially junior. Senior, no problem. When he makes a decision, you can stick to it. Where is a question of conflict resolution in an acute problem? But there'll be enough juniors who will keep, prancing around with their own opinions in that very tense atmosphere where minute to minute things will change in physiology, and decision making is very important. So you need to have a fair amount of internal stability to handle those juniors in the best interest of the patient. They have a right to their opinion, but also you have a right to your decision. So you should find that balance in communication when you're putting down your foot and saying, no, I need to do a splenectomy in this patient. Number one. So that is why don't think soft skills means jelly skills, that anybody is able to manipulate you to make a decision just because you have to be polite. No, in fact, some of the soft skills can be really hard skills. Your decision making, you have to stand by it. You cannot get swayed around by different decision makers who are not directly responsible for the outcomes. So now, as I told you, this is the intraoperative. I purposely put the same slide again so that you can pause and read exactly the components of soft skill in this particular situation. So how do you teach them? Not everybody will be born with all the soft skills. People are more involved in getting the hard skills, the technical skills, so that they can be employable. But you need to have soft skills also, which may be taught in your medical school. But in medical school, the focus will be on to teach you the technical skills. They will not teach you soft skills at the expense of technical skills. So what are the training and teaching methods? Simulations. You give a scenario, like the previous slide was a scenario, or you give a scenario and ask them what they would do. Role playing. You can have your teachers themselves as patients and etc. Online courses. Online courses are quite popular in the low and middle income countries, for that matter even in the high income countries, because your online course can be made once and peddled thousands of times. But if you're going to use role playing, then it's very difficult. You have to get the actors into place, either your teachers or paid actors. It is not possible. So online courses which have very good feedback, they are very useful. There are other methods, we are not going to it. I'm just telling you a few examples. How do you know the person has got the soft skills after the training? One is a multi-source feedback. Patients will feedback, juniors will feedback, support staff will feedback, your seniors may give you feedback. Self-assessment and reflection. You yourself can, at the end of the day, you yourself can do a self-assessment. Where are my soft skills? What are my strengths? What are my weaknesses? What I need to work on? and you can have structured clinical examination. These soft skills can be structured or incorporated into your clinical exams when you give your ward living, or when your teacher is taking a bedside clinic. He can also insist that this particular issue is a soft skill, like the way he talks to the patient. After talking, he can get back to the students and say, see, I asked him that question in such a way that he's not offended. I made sure he's comfortable. So all these are soft skills. Students should also know that these particular components in the teaching session belong to the soft skills. So what are the challenges in implementation? One will be the barriers. Of course, language, geographical differences. People may be working in the rural areas. Difficult for them to come and learn what is a soft skill somewhere else and go back. Large countries, these are problems in every sector. Cultural differences and language barriers may be there. What are the solutions? You can use technology for online learning or your telemedicine. When you're consulting in your telemedicine, you can always tell the doctor on the other end, the junior doctor on the other end. You can just put in 2 lines about soft skills in that particular scenario. Not take a lecture on soft skills, but during your telemedicine, you can give him 2 lines about soft skills. This is how you initiate people into soft skills. So developing soft skills is not only for patient outcome, it is also for well-being of the healthcare provider. Just imagine you've worked on your emotional intelligence, you've worked on your leadership, you've worked on your communication. Life will be so easy in a highly intensive sector like healthcare, and more than that, your surgery also. This physiological guilt, depression, loss of self-esteem, and lawsuits, all these you'll be able to handle them. Now, one, your lawsuits itself will be less when you have enough soft skills. Something has gone wrong. You go and explain to the patient very well. The chances of them going to the court is far, far less than when you ignore them or when you're harsh after making a mistake. So all these things matter. So soft skills, number one, for patient outcome. Number two, to reduce lawsuits. And number two, even if there are no lawsuits, to have a well-being for the surgeon and the physician themselves. So when I say there is a medical error, there are 2 victims. One is the patient and another one is the physician or the surgeon. The healthcare provider is also a victim. Keep this in mind. So, and soft skills, they are continuous development. It's not that once you attend a particular course and you come back, yes, you get a certificate, but how far have you incorporated them or willing to incorporate them in your day-to-day practice? So the idea is to encourage soft skills in the teaching program itself. It can't be just taken as a lecture. It can be taken as a lecture, but it is duty bound on every teacher whenever they take a class to try their best to talk at least 2 lines on soft skills in that particular clinical scenario. It makes a lot of difference so that the knowledge gained is in a slow, steady way in the student's mind. So that was a very short presentation on soft skills because this is the latest thing being asked from your surgical audit. These things come very easily: patient safety, surgical audit, and soft skills. It is not some disease where you talk about etiology, symptoms, signs, treatment, complications. These are very managerial sort of skills, which is not very easy to take in one class, but you should know the basics. Now, thank you very much, and I will ask you to subscribe, share, and like. Please do nudge your friends also to subscribe to the channel. And any doubts you have, please comment on the chat box. And also, my Telegram channel is there. You can raise your questions there. Thank you again.